Hi, good evening everyone. Welcome to another live session by IILT. So in today's live session, I'll be taking you through a very important key aspect of OET speaking, which is the action verbs. So I've been getting a lot of requests to do a video on this one, or a content video or a live session on this one, because this is a very important area that you can see in your speaking cue cards. And if you have a clear-cut understanding about how to move forward with this particular point or how to elaborate the action words in the right way, then it is going to be very helpful for you guys to do the role play with the proper communication and with the proper flow of the conversation too. So we will be discussing the common action verbs that you might come across in the role play card while you're attending the test. So I have picked the common ones. There might be more than this. Okay, so if you want an explanation for any other action verb which is not mentioned or discussed in this particular session, feel free to comment and we will definitely get into it as well. Okay, so there are a lot of points that we are going to discuss today, and I hope you guys will understand it very much, as well as if you have any doubts or queries, feel free to raise it too. Okay, so we will begin in a while. So I hope everyone is doing fine. Yes, so the point action verb, you might have heard it or you might not have heard it too. So after today's class, you need to understand that this is very important when it comes to your IT speaking or developing your conversation as well. Okay, so what is action verb, or what are action verbs? You might have seen it, definitely seen it in the role plays. You might know, okay, these words, okay, the words that we're going to discuss, it might be very familiar for you, but you might not be knowing, okay, this is action verb, or these are the action verbs, and you might not be even knowing the importance of it, or why is it so important that you have to prepare these points as well. So that is what we are going to discuss in this particular live session today. So let's move on with this. So first, let's see what are action verbs. Okay, so action verbs are nothing but it denotes the action you as the candidate need to demonstrate in the role plays using appropriate language. Okay, so as the word suggests, action verbs are the verbs which denotes an action that you need to do in that particular task. So each task will have an action verb. Okay, one or more action verbs will be there for each task, and that particular thing means you have to do that. Okay, in that particular task, that task will be demanding you to do a particular action. So that is what is called action verb. And you can use functional phrases to elaborate the given action verb, and in this particular session, this is what we are going to learn. We are going to learn certain functional phrases you can use in order to have a smooth conversation throughout. Okay, and these functional phrases will definitely help you to have a proper beginning of each task. So if you have noticed, each task will start with an action verb, okay, like find out, give, provide information, such as these words. So if you know a functional phrase to elaborate this particular point, you can have a smooth beginning or a start for each of the tasks as well. So that is why it is very important that you know the action verbs, the common ones, and you also prepare a functional phrase for it. You need to have a proper understanding. Okay, if this is my action verb, this is how I'm going to start that particular task. Okay, so this session is going to help you in that aspect. So if you are a person who struggle with the beginning, or if you get in a confusion about how to move forward or how to start a particular task, and if you always get stuck on that particular aspect, this is going to help you. Okay, so let's move on. So let's have a look at the common action verbs in OET speaking. So the first set of words or action verbs that you can see would be find out, ask, explore, collect, gather. So in this particular segment, we are actually discussing find out, ask, explore, collect, gather, 5 different action verbs. The reason why I have put them together separated with a slash is because these 5 verbs actually indicate the same thing. Okay, all of these things have the same meaning. So if you see find out on your cue card, or if you see collect or explore or ask or gather, this is the meaning. You have to gather information from the patient. You're going to find out some information from the patient. Okay, so that's the reason why I've clubbed all the different action verbs which indicates the same thing together, so that if any of this comes, you can use the statements which we are going to discuss coming later. Okay, so let's see the first statement that you can use. So if you get any of these action verbs, a really good statement that you can use is, I would like to know more about your condition. You're trying to know. Okay, imagine your task is find out more about the condition, or find out about the symptoms, or ask for the symptoms, or collect information about the symptoms of the patient, or previous occurrences of it, or a family history, gather information about the family history. So if you get any of these tasks, then you can use the statement, I would like to know more about your condition, or you can say, I would like to know more about the symptoms you have been experiencing. So this is the opening phrase, I would like to know. Okay, we are trying to know more about it. Okay, or you can even say, I would like to ask. Say for example, your task is find out, and while you're saying the opening statement, you can say like, I would like to ask you some questions, or you can say, I would like to collect some information from you, or you can even say, I would like to gather some information from you. Okay, so these are the different ways of doing it. This is just one statement. We will see more statements for it. Okay. The next statement is, if you don't mind me asking. Okay, if you don't mind me asking, can I ask you some questions, or can you please tell me about it? Okay, likewise, you can just move on. Okay, that is another start if you get any of these action words. The next one, could you please elaborate? Okay, which means you want the patient to give more details. You want a detailed explanation, so you can use this one, could you please elaborate? Next one, could you please tell me? Okay, these are different ways of doing it. Okay, all these statements that indicate the same thing but in different formats. A construction, the structural formation is different, but if your action word is any of these, then these are the perfect opening statements that you can use. Okay, let's see the next one. I need some information from you. Okay, imagine your task is ask more about the lifestyle of the patient. I need some information from you. Okay, so these are certain opening statements that you can use if your action word is find out, ask, explore, collect, or gather. And I will discuss one more with you. I would like to ask you some questions about. Okay, this is another rephrased statement of the previous one. I need some information from you. You can say, I would like to ask some questions about this. Okay, if it is precisely mentioned, ask questions about the symptoms, or ask questions about the family history, then you can mention that too. I would like to ask you some questions about the family history, or I would like to ask some questions about the frequency of the symptoms. So there will be different things that you need to gather from the patient. So these are the different functional phrases that you can use if your action verb indicates any of this, which means you're trying to gather or collect information from the patient. So you can try to use any of these. Okay, so that is the first set. So I hope it is clear for you guys. Let's move on to the next set. The next set is explain, tell, inform, outline, elaborate, discuss. So if your action verb is any of these, okay, so these words, it indicates that you are educating the patient about certain things. You are providing information, you are passing on information, you are educating the patient about certain things. Okay, so if your action word or if your task starts with any of these, let's see what are the statements that you can use. The first statement that you can use is, I will tell you everything in detail. I will tell you everything in detail. That's a common statement that we all know. We all have been using it as well. So you don't need any extra explanation for that particular statement. So it is a very common one. The next one is, I would like to explain the procedure to you. Okay. Imagine your task says something like inform the patient about the procedure of the surgery. So you can say, I would like to explain the procedure to you. Okay, so that is also another tip that you can keep in mind. Okay, so you know that these are the synonyms for the word explain, or these words or these forms actually indicate the same thing or actually mean the same thing. So if your task is explain, you can use another word, inform. Okay, if it is explain in the task, then you can say, I would like to inform you, or I would like to discuss, or I would like to tell you, or I would like to elaborate the points to you. Okay, so you can definitely use the synonyms as well. So imagine that your task starts with discuss the importance of. Okay, so you can say, I would like to explain the importance of. So this is how you rearrange it and you use it appropriately depending on the context. Okay, that is how you can improvise yourself too. So this is also accepted. So next statement. Don't worry, I'll take you through the different treatment options. So this is a different statement. Usually I have not seen students using this statement in a role play. So this means that you will take the patient through the different treatment options, which means that you will explain everything in detail about the different treatment options. So that is a really good statement that you can use. Don't worry, I'll take you through the different treatment options. Okay. Next. If you don't mind, I would like to discuss the importance of, and then you can explain it. It might be, following the instructions of the doctor, or doing a treatment like a chemotherapy, or starting with a medication, or changing from oral medications to IV. So there would be certain things that you need to explain to the patient. It will be given in the cue card as well. So what you can do is you can just use a statement like this. If you don't mind, I would like to discuss the importance of. Okay, this is another statement that you can use there. Then you can even use this one. Please be relaxed. I'll give you an outline of the procedure. Okay, so as we discussed for the second point here, if your task demands you to explain the procedure to the patient, you can use this one. Please be relaxed. I'll give you an outline, which means that in brief, okay, you will brief it out. So you can use this statement too. Okay, so these, the last one is, please allow me to explain. Okay, if you want to explain certain things or inform the patient about an important thing, you can say, Mr. David, please allow me to explain. And then you can continue, please allow me to explain why it is important that you undergo the surgery. Okay, so these ways you can start the task and then build on the continuous construction of the statement depending on the context, and you can select the right choice of words and you can finish the statement. That is what you can do. So these are the different statements you can use to start the role play, not the role play, to start the task. Each task, if your action word is either explain, tell, inform, outline, elaborate, or discuss. Okay, as I told you, you can even rearrange these as well. Okay, I'm just repeating the thing again for you. If your task says discuss the importance, you can say, I would like to explain the importance. Okay, or if it is outline the procedure, you can say, I would like to inform the procedure for you, or the steps involved in the procedure. So you can rearrange it as well. You can use the synonyms, you can use different words with the same meaning, and you can complete the task or start the task properly. Okay, so these are the next set of action words, and I hope it is clear for you guys. So we have seen two sets of action words which means the same. Okay, that's the reason why I put different slash. These are all separate action verbs that you can see in the role play. In a single role play itself, you can see all these things. And when it comes to the examination point of view, the action verbs like outline, elaborate, these are very common when it comes to the exam type of questions as well. Okay, so you need to know or you need to have a clear understanding about how to have an opening statement or how to start that particular task if your action word is so and so. So keep that in mind. So this is the next point. Now let's see the next set. Okay, the next set of action verbs: emphasize, reinforce, stress, underline. Okay, these are also very popular when it comes to the exam cue cards. You can see this if you have the habit of following the exam cue cards, and if you look at them very closely, you can see these words recurrently. Okay, these are very common in that. And how you can do it. Before we get into the different statements, the first thing you need to understand is, what do you mean by this? Emphasize, reinforce, stress, underline. which means you have to explain the importance of doing something or stop doing something in a very serious note. Okay, the patient must understand it, or you have to reinforce it. That means that you have to push that information into the patient's mind. That doesn't mean you have to verbally push it. You have to use the right choice of words to make the patient understand how serious that particular point is to be noted. Okay, so that is how you have to do this. And if you get any of these action words, don't worry, you have a list of statements that you can use. So let's have a look at those. The first one, let's look at the importance of doing exercises every day. Okay, imagine your task says emphasize the importance of doing exercises every day. So you can start by saying, let's look at the importance of doing exercises every day. That's a brilliant way to start it. Instead of repeatedly saying, I would like to tell you the importance of doing exercise, because this is a very favorite functional phrase that all the OET students use. I would like to explain, I would like to tell you, I would like to discuss. It is repeatedly used. So try to rearrange the statements by replacing, not replacing, by completely avoiding I would like to. I'm not saying there is something wrong in it. Nothing is wrong with I would like to. But if you notice, or if you have noticed it, you can find you've been repeating this I would like to very often in your role plays, maybe in each of the tasks as well. Whenever there is a change in topic after signposting, you would end up saying this thing. So in order to avoid the repetition and to have or to show that you have a good level of proficiency in the language, you can try to use different statements by rearranging the meaning. Okay. So instead of saying, I would like to discuss the importance of doing exercise, you can say, let's look at the importance of doing exercises every day. That is one way of doing it. Next one, it is significant to take the medications on time. Imagine your task says, reinforce the importance to take medicines on time. That is your task. Reinforce the importance of taking medication on time. You can say this, it is significant to take the medications on time. Okay, that is one way of doing it. If you want, you can add a few words in before that particular statement too. You can say something like, Mr. David, please note, it is significant to take the medications on time. Next statement, please ensure that you follow the instructions given by the doctor. Instead of saying, I would like to tell you that you have to follow the instructions given by the doctor, you can use this one. Please ensure or please make sure, both are fine, that you follow the instructions given by the doctor. Next one, it is to be noted that you refrain from any strenuous activities. It is to be noted. Please note, another way of saying please note. Okay, it is to be noted that you refrain, that you don't. You can use another word, that is refrain, that you refrain from any strenuous, any heavy activities, strenuous activities, rigorous activities, okay? Any strenuous activities. So that is another way of reinforcing statement, or that is another way. You might have seen the task starting with stress. Stress the importance of not lifting heavy objects. Okay, this is one perfect statement to explain that. It is to be noted that you refrain from any strenuous activities. Then, next one, please keep in mind. That is a beautiful, simple statement that you can use to, double ensure any particular information that you want to provide to the patient. Please keep in mind to take the medication on time. Okay, that is a very beautiful and very simple but elegant statement that you can use. Next one, before we move on, it is paramount that I inform you the necessity to stay hydrated. This is a beautifully constructed statement. Okay, so imagine your task says something like this, underline the importance of drinking water or staying hydrated. Okay, you can say this. Before we move on, it is paramount, means it is important that I inform you the necessity of staying hydrated. Okay, so that is also a good statement that you can use. You can try this particular statement in different aspects. Okay, you can try something like before we move on, it is paramount that I inform you the necessity to stay at the hospital. We might have seen a lot of cases where the patient is at the hospital and he's not very happy to continue the hospital stay. However, the patient has to stay there because the patient has to be observed for a couple of days more to make sure that there is something wrong with the patient. So in that cases, you can try this. It is paramount that I explain why or as to what is the requirement of you being in the hospital. Okay, so that is the point which has been explained here. So this is a really good statement that you can learn. So if you get any of these action words, emphasize, reinforce, stress, or underline. Again, you can rearrange. Okay, so say for example, if your task starts with emphasize, try to use reinforce. Okay, emphasize the importance of doing something. You can say, I would like to reinforce the significance of this. Or if your task starts with reinforce, you can go back to emphasize or underline. I would like to underline the importance of it, or I would like to stress the importance on this. You can try that too. Okay, so try to rearrange the statements and try to make sure that you use different types of statements. So it will definitely help you to boost your language skills as well, so that you are more involved in improvising your language ability too. Okay, so these are the certain words or statements that you can use when it comes to this set of action verbs. So I hope that is clear. Moving on to the next one, persuade or convince. So this is also a very common action verb that we all know. We all might have seen it as well. Persuade the patient or console the patient. Okay, persuade the patient is also common, but not as common as console. You'll see this particular word almost in every cue card. Console the patient, address the concerns and console the patient. So how can we do it? So you need to understand persuade, not console, it is convince. So persuade or convince means you are trying to encourage the patient to do certain things. Okay, you are trying to make them feel okay about the suggestions or trying to motivate them to follow your suggestions. Okay, so let's see how we can do it, how we can persuade them without being pushy or bossy. How can you do that? Given your condition, you need to take rest for at least 3 months. We are trying to convince the patient, given your condition. That means your condition is bad. Given your condition, it is highly suggested that you take rest for at least 3 months. Okay, next one. It can be difficult for you initially. We're trying to convince. Okay, it can be difficult for you initially. However, you will be able to notice the improvement in your health gradually. Yes, initially it might be a little tedious for you, you might not be liking it at all, but gradually you will definitely see the changes, or you will definitely see the improvement in your condition. Okay, that is another convincing or another good statement that you can use to persuade the patient into doing something. Okay, that is a really great statement. The next one, I respect your decision, Mr. Javier, but I assure you that I have your best interest at heart. See, that's a great statement that you can use to convince your patient. If your patient is not at all cooperating with you and you're finding it very difficult, you can try this. Yes, I respect what you're saying, but I have the best interest for you at heart. I really wish for your well-being. I really hope that you will recover. Okay, so in order to provoke the patient, or in order to promote or encourage the patient into doing certain things, if he's really reluctant or stubborn about your suggestions, then you can try this one. I respect your decision, Mr. Javier, but I assure you that I have your best interest at heart, because that means I really wish for your well-being. So please cooperate. So these are the certain statements that you can use when it comes to persuading or convincing the patient. So I hope it is clear for you guys. So you guys will definitely come across certain action verbs in your role play cards, and if you have a clear understanding about, okay, if this is my action verb, this is how I'm going to start. If you have a clear idea about it, then yes, you can certainly go for it. Okay, this will definitely help you, And also when you have a clear understanding about how to move from one task to another by understanding the action verbs prior to your examination, that is going to make your entire examination a little more smooth and easy, because you already know the statement, you are prepared, you have prepared the functional phrases here, so you will automatically, okay, whenever you see persuade, okay, this is a statement, convince, this is a statement, okay, so you will be automatically directed to that point, and you do not have to struggle so much to find out what is the appropriate statement while doing the examination or while doing the role play. You will automatically do it. Okay, so in order to do that, you need the proper practice, you need to be very familiar with the different action words, and you need to know the proper functional phrase that you can use, you know, across to the appropriate ones. So these are different statements that you can use when your action verb is persuade or convince. Okay. So that being said, let's move on to the next point. So the next one is console or encourage. This is very important, okay, because as I was telling you a little earlier, as we have seen persuade or convince the patient, this is also a very common one that you can see in your role play. Console and encourage the patient. Console is very sure, okay, like, you know, it is very much popular when it comes to the cue cards. And whenever you see console statements, you need to understand that that is a point where you're emotionally supporting the patient. So the best way to do that is by giving situational acknowledgements as well as by using really good empathy statements. So I have made a list of a couple of good acknowledgement statements, situational ones, and couple of empathy statements as well. So I hope you can refer to this, and whenever you are using these acknowledgement statements or empathy statements, the point that you have to keep in mind is that you do not just use random empathy statements, you know, just like that. Don't do it. Understand the context, try to figure out what exactly is the emotional concern or what exactly is the point the patient is trying to explain to you, and based on that you have to provide the right situational acknowledgement too. Okay, that is how you will improve, or that is how you will develop a good relationship with the patient. So in turn you will have a beautiful score for the clinical communication aspect too. So let's see how you can console or how you can encourage the patient in different sentences. The first statement, I do understand how difficult the situation is for you. Please be relaxed. We will take good care of you. Okay, we are consoling the patient. I do understand it is difficult for you, but please be relaxed. Okay, we will take good care of you. I can only imagine how stressful it must be for you. Okay, so this is a beautiful statement, and it is called indirect empathy. So whenever I take classes, I always tell my students about direct empathy and indirect empathy. So direct empathy is nothing but you have faced the similar situation in your life, so you can empathize with the patient directly, like you can relate to it because it has already happened in your life, you know it. But when it comes to indirect empathy, that is the general empathy that we all show to each other, like we might not have experienced it on a personal level, but we know that that is a severe thing and we can understand that is difficult for the other person. So based on that, we will show indirect empathy too. So when you say I can only imagine, that means that I have never experienced it, but I can only imagine how stressful it is for you. Okay, because I have never gone through, gone through that particular emotional state. But if, say for example, I had a broken hand, touch wood, I had a broken hand, and the patient also has a broken hand. So in my medical history, I had a history of broken hand previously. So the patient is telling me, oh, it is really painful. So since I already have a broken hand history, I can say, yes, I can understand, because I also had a broken hand back in 5 years or 4 years. So you can say something like that. So if you have already experienced that, then that is a point where you can show direct empathy. Or if you have not, then you can show indirect empathy. Another example would be if you are a mother or if you are a parent, and if you are talking to a concerned parent, so you can say, as a concerned parent, I do understand. I have a child of the same age, so I do understand the difficulty level. So that is what is direct empathy. You are directly showing the empathy, okay, because you can relate to it directly. It has happened, or you have experienced the same thing. If you have not experienced it, or if you can't relate it on a personal level, then you have to show indirect empathy like this. Okay. The next one is, if it's any consolation, there are many people who have recovered from the same condition like that of yours. Yes, so that is a new statement for you guys, and I'm pretty sure that there might be some people who already know it, but still I have not heard a lot of people using it, so this is a good statement that you can use. So the meaning of this is, if it's any consolation means if it gives you any peace of mind. Okay, then you're saying there are many people who have recovered from the same condition like that of yours, which means your patient or the patient that you're dealing with has a very serious condition, and the patient is already upset, and he's so sad and fed up that he's not going to recover, and he is hopeless. So you can say, if it is any consolation, we have dealt with many cases and those people have recovered. So if you want to encourage or motivate the patient to look forward to the life, okay, then you can try to use it. Okay, this is a good statement you can use there. So if it's any consolation means, you know about consolation prizes, right? So what is the purpose of consolation prizes? It is just to motivate the people who couldn't get the first or second prize to participate again the next time, so they don't feel bad. So we are actually motivating them to perform the next time in a better way and get the first or second prize. So that is what is consolation prize, right? So likewise here also consolation means the same thing. So if you are giving a comfort for the patient, if it comforts you or if it gives you any peace of mind, so that is the meaning of if it's any consolation. Moving on to the next one. Don't worry, we are all trained and equipped to handle any unforeseen situations. That is a common statement, and I have discussed about this in one of the content videos as well under the empathy statements category. So yes, this is also a good one. You can use these statements as reassurance statements as well, and we'll be discussing about reassurance in the next slide, I think so. So yes, these statements can be used as reassuring statements too. Okay, next one. It can be very difficult to make the changes all of a sudden, but it will certainly pay off. Yes, it will certainly pay off. Okay, that is a really good encouraging statement that you can use. It will certainly, when you use good choice of words like definitely, certainly, it's the ideal option for you. Okay, it is the appropriate one for you, exactly. So when you use positive words in your role play, that is going to do wonders in your role play. Trust me, when you try to improvise or change or reduce the intensity of negativity in your role play, that is the time that you're going to build a good relationship with the patient, and the patient will be more comfortable with you. The patient will have a good aspect about life, and he will be looking forward. Yes, if I follow all these things, definitely I can see some changes, and the trust development will be more as well. So try to use positive words like definitely, certainly, but keep in mind, do not use it unless and until the cue card says yes, the patient will recover. Okay, if it's just a possibility or a probability that the patient will recover, do not say you will definitely recover. Okay, that is wrong. There you are giving false information, but you are very sure and it is given in the cue card, or the cue card hints you that yes, if the patient is going to follow all these instructions, there is a possibility, not a possibility, there are high chances that the patient can recover very well. Then you can use the words like definitely, certainly, absolutely. Okay, so these words will obviously boost the confidence of the patient, and he will tend to have a good relationship with you as well. Okay, so try to use statements like this too. So it can be very difficult to make the changes. So here you can use this when you are trying to encourage the patient to follow certain suggestions that you have made, and the patient says, oh, I don't think so, because it would be really difficult for me to give up smoking because I have the habit of smoking for the past 10-15 years, so it has been a part and parcel of my life. You can say this. It might be difficult to make the changes all of a sudden, okay, but it will certainly pay off. But if you are determined about it, you can definitely get out of it. Okay, so that is the point that you're going to explain here. And pay off, it will certainly pay off means, we have heard people saying hard work pays off, right? Likewise, that means it is worth to do some changes. That means you will get the return. There will be a proper outcome from it. Okay, so these are different statements that you can use when it comes to console and encourage. And again, I'm repeating, you can use these statements in wherever ways you can reassure the patient and motivate the patient to do certain things. Okay, so these are not just confined to console and encourage the patient, it can be also used if you have to reassure the patient about certain things. Okay, so that being said, let's move on to the next point, reassure. As I've told you, this is a point that you have to do in all the role plays. Not even a single role play passes without you reassuring the patient, right? You have to certainly do it. So let's see, and it is not necessary that you have to always use I reassure you. Whenever you see reassure, it doesn't mean that you have to use the term I reassure you for sure in the role plays. No, okay, you don't have to. That is just one statement that you can use. You just need to make sure that the words that you have selected to put in the sentence that you're going to convey has the right intensity or has the right meaning that you're intending to convey. Okay, so you need to make sure the keywords are appropriate. The keywords means the words which carry the information. So you need to ensure that the words that you have chosen to carry the information has the right information. That is the only point that you have to keep in mind while you're doing it. You do not have to exactly use the term I reassure. Instead, you can use certain words like this as well. So let's discuss that. But first, let's see the common statement that we all know for sure. I reassure you that slight changes in your routine can bring a great improvement in your condition. Okay, so we have seen a similar sentence in the previous one as well, this one, the last one. It can be very difficult, but it will certainly pay off. That's the reason I was telling you, you can use these statements as reassurance statements as well, okay. I reassure you that slight changes in your routine can bring a great improvement in your condition. Let's look at the next one. I have dealt with many patients with the same condition like that of yours, therefore I can provide appropriate care and assistance to you. We are reassuring the patient that the patient is in safe hands, that you are perfect or you are good enough to look after the patient. Okay, so you have selected the right words here by saying that you have dealt with many patients with the same condition like that of yours, which means I've seen many patients like you. Therefore, I can provide appropriate care and assistance to you. Okay, so that is the right choice of words. Then you can use this statement to let's see what we can do about it now. Okay, when you use this statement, you are reassuring the patient that the patient is not alone. You said that let's see what we can do about it. That means the patient won't feel alone in that. The patient, if the patient has any concern or if the patient is lacking in something or if the patient has any problems, the patient will not feel left alone. When you say let's see what we can do about it, you are reassuring the patient is supported or you are there to support the patient. Okay, and the last statement that you can use to reassure is I will definitely provide all the assistance you may need. You are reassuring the patient again that you will take care of the patient. So that word definitely, it might look very simple, but it has got a lot of power when it comes to assuring a person. Okay, so whenever you say I'll definitely take care of you or I'll definitely provide assistance to you, that gives a strong impact in the patient's mind as well. So try to use really good positive words in your role plays to build a good relationship with the patient. So it will also help you to understand the patient's point of view, and once you have understood it, you can easily incorporate that in the role play too. And all these points, these have got a score when it comes to your assessment as well, because you know under the clinical communication criteria you have certain criterions like understanding patient's perspective and building a relationship with the patient. So these points will definitely help you to get a better score. So try to make sure that you are having a good relationship with the patient by using the right choice of words, which will definitely boost your score. Okay, so that is reassure. And this is the last point that we are going to discuss, which is resist. So the reason why I have kept it towards the last is because this is a point that I have seen where my students struggle a little bit. Okay, because you really get confused about what is the right choice of words that you can use to not provide an information or not to help a patient with something. So how can you say no? Resist means you are saying no. So it is not very easy to say no, and we cannot directly say no on the patient's face as well. So you need to pick appropriate words to indicate that you can't help. Although you want to help, you can't help. So let's see how we can do it. The first one, I'm afraid I'm not the right person to comment on that. Okay, so if the patient asks you about something, so if I do all these things, are you sure that I'll recover? So either you can say, well, it depends on person to person, the doctor will be here. So that is one point you can say the doctor will address to the concerns. Other than that, this statement is also really good. I'm afraid I am not the right person to comment on that. Okay, so you mean to say that I want to help you, but I don't think I'm the right person to do so. Okay, so when you use I'm afraid, the common mistake I've seen, is people tend to say I'm afraid to. When you say I'm afraid to, that means that you are scared. Don't use that to here. Okay, when it comes to the OET role play aspect, I'm afraid means that you want to help, but for some reasons you can't. Okay, that's the reason why you're saying. So it is another way of saying I'm sorry. I'm sorry, I want to help you, but I can't. That is another way of saying it. Okay, so do not say I'm afraid to. You have to always keep that in mind. If you say I'm afraid to do it, that means that you're scared of doing it. You're not scared here. Okay, you just feel sorry that you can't help. So you have to always keep that in mind. Okay, so the right way of saying it is I'm afraid I'm not the right person to comment on that. Next statement, I'm sorry, it's beyond my scope of practice. Another way of doing the first statement, I'm sorry, it's beyond my scope of practice, which means my scope is limited to this particular area and that is someone else's thing, or I am not registered enough to do that. Okay, so say for example, we cannot give the diagnosis or we cannot tell the patient about the discharge. The doctor has to give the ideas about that, or the doctor has to come and tell you that yes, the patient is good enough to go home. So that is the decision that has the authority, or the doctor is the one who has the authority to make that decision. You don't have that. So you can explain this, it is beyond my scope of practice. The next one, I cannot be of any help in that aspect. The doctor is the right one to do so. Okay, I cannot be of any help in that aspect. The doctor is the right one to do so. The next one, I wish I could help you here, but I'm not the right person. I wish I could help you here, but I'm not the right person. So if you notice that very closely, all these statements are rewriters. Okay, so the following statements are the paraphrased form of the first one. Okay, so it is actually having the same meaning and the words and other structure has been rearranged by using synonyms, or the structure, the sentence construction has been changed. So it is actually meaning the same thing. Okay, all these things, it conveys the same thing. The last statement, I'm sorry, it's hard to give an exact time frame of your recovery. It varies from person to person. You may please discuss it with the doctor while he is here for his rounds. Okay, so this statement means I cannot give an exact time frame. You're resisting the information. You might know the time frame, but you have, it is mentioned in the cue card, resist information about the recovery. So you can say, I'm sorry, it's it's hard to give an exact time frame of your recovery. It varies from person to person. You may please discuss it with the doctor when he is here for his rounds. So you are actually deviating the thought process into the doctor. So the patient will be thinking, yes, the doctor will be here, so I can speak to the doctor about it. So that is how you deal with this thing. Okay, and always keep in mind, resist means you have to say a no in a very polite way, and these are the different ways of saying no in a polite way. Okay, so I hope it is clear for you guys. So these are the common action verbs that you can see when it comes to your OET role play. So we have seen quite a lot of number of action words. In the first 3 slides we have seen slashes, but those are all different action verbs as well. Okay, so we have seen resist, reassure, console, encourage, so that makes it 4. Then we have seen persuade and convince, so that is 6. Then we have seen emphasize, reinforce, stress and underline, so that makes it 10. Then you have seen explain, tell, inform, outline, elaborate, discuss, so that is 6, right? So that is 16. Then we have seen this one too. find out, ask, explore, collect and gather. So that was 5. So altogether we have seen 20 to 21 different action verbs and the different ways of doing it too. So I have discussed a lot of statements which will definitely help you to build the conversation in a very easy manner. So the reason why we have learned this is because imagine a cue card in your mind and each cue card will start with any of these. Okay, so when you see that, you need to have an idea about, okay, if this is my action verb, this is how I'm going to start, or this is the elaborated version of my action verb. So you need to have an idea about that. So if you have a clear cut idea about it, then you can actually start with the conversation in a very easy manner, and you do not have to worry about how to do it or what is next or how to construct that particular statement. So always keep this in mind. Okay, once you have learned the functional areas, then it is going, the functional phrases for each action verb, then it is going to be really easy for you. Trust me, it is going to be very easy. And as I told you, we have discussed around 20 to 21 different action verbs. I'm not saying it is limited to these, but these are the common action verbs that you can see. There are more to it. So if you come across any other action verb that you know that was not discussed in this one and you would like to get an explanation about it, feel free to comment. I will definitely get back to you. Okay, so I hope it was helpful for you guys. If yes, please do let us know. You can post your valuable comment in the comment section, and if you found it helpful, feel free to let us know about that too and share it with your friends who are also preparing for OET. So we will come back with another live session very soon. Until then, you take care. Good night.